clinical day to be here and talk with us.
Amy, thank you so much for having me. It's really a privilege and happy to be able to speak with everyone about this.
Fantastic. Well, we will just jump right into it because I'm sure people have questions. And if you do, feel free to type it into the chat here. We will be watching and answering your questions as we go along. Dr. Friedman, this is a very interesting year to say the least, right? We know that everybody's stress levels have likely gone up over the past several months related to COVID-19, dealing with that pandemic, and also with the upcoming election. So I just love to hear from you to start out. Could you tell us about the importance of doing things like taking your prescribed medications and seeing your primary care physician or any specialist that you may have, especially if you do have some underlying health conditions?
Yeah, absolutely. I mean, first of all, we hope all of the audience members haven't been personally impacted by this. This is a really terrible disease. It's caused a lot of trauma to people, and so we hope everyone is staying safe and that their family members are safe. Being a sports cardiologist, we often talk in sports terms. So the fundamentals are really important. And the fundamentals are exactly as you mentioned, taking care of one's health when it comes to wellness. And that does include taking the medications. That does include exercising, touching base with your primary care physician, doing the annual cancer screenings that need to be done for the age-appropriate screenings, and knowing your numbers too, which we always talk about from the cardiovascular perspective. What's your blood pressure? What's your blood glucose? What are your cholesterol numbers? These are really important things that form the foundation and the basis for wellness and health moving forward. So yes, it's stressful. Yes, these are, the unprecedented times, as we keep saying, but we're losing track of a lot of the things that can help build our health moving forward. And we try not to forget those as best we can.
Yeah, sometimes it's easy to forget the simple things, right? The things that we're supposed to do every day, because sometimes we're not even paying attention to the fact that we're doing them. And so they just slip out of our mind. So it's a good reminder for anyone out there, if you haven't seen your physician or if you've been, missing some of your medications, be sure to check in. That's what we're here to help you with. Dr. Friedman, isn't it true that stress has immediate effects on a person's health? And particularly if someone has an underlying health condition, some people don't even know about it. I heard that high blood pressure is also called like the silent condition. Sometimes there aren't symptoms that go along with it. Can you talk about how stress impacts individuals with high blood pressure and what they could do about it?
1,000,000%. So stress is very difficult to quantify in terms of how do we measure stress? But we know that stress has significant physiologic impacts on the body. It changes how our bodies function. So when we are stressed, we gain weight. When we're stressed, we don't exercise as well. We don't sleep as well. We don't eat as well. Our blood pressure does go up. Our blood sugar goes up. Really, our general health, when exposed to stress for long periods, is not healthy for us overall. So, and you're exactly right. Blood pressure is called the silent killer for a reason, because most often people walking around with blood pressures of 160 systolic, 170 won't feel that. Some people will have headaches, but a lot won't. A lot won't know sort of that repetitive damage that's taking place over and over again from elevated blood pressures from stress. It's really important to recognize when we're feeling stress. It's really important to try to deal with that. Speaking with people such as yourself, or any other mental health professional out there, this is something that's often forgotten about. So we definitely should recognize the stress within ourselves and try our best to come up with an action plan to deal with it.
And thank you for talking about that, because sometimes you hear that, right, like you have too much stress, or, you've got high blood pressure, hypertension, manage your stress. And it's one of those things that I've been hearing for so long, you never know if that's true or if it's one of those wives' tales, because, we know there's a lot of information right on the internet. So it's glad to hear that.
It's really true. And in fact, often in medicine, we're confined to 15 and 20-minute appointments where we look at blood work results, we look at tests, and we throw medications at a problem. But we don't really spend enough time talking about how are we dealing with stress? How are we exercising? How's our mental health? I've used the word already, but wellness. Wellness is a really important word. It doesn't just deal with health. It deals with how do we sleep? How do we exercise? How are our social connections? And if you look at these areas called blue zones throughout the world, the people who really achieve wellness are the ones who are able to holistically deal with their health. It's not just confined to blood work and diagnostic tests. It's really an all-encompassing matter. Stress is a huge part of that.
Yeah, and I think sometimes when I hear people say the word wellness, right, I'm absolutely a big fan, but sometimes it sounds like this nice extra thing that we can get. But like you said, it's not. It's actually an integral part of us living healthy lives. So thank you for pointing out to those.
And it's also, and don't mean to cut you off, but it's not a destination. You don't arrive there. It's constantly a journey of trying to achieve that wellness, and there will be peaks and valleys along that journey. But it is something we should always be striving for and sort of remaking ourselves and defining our wellness as we move along the journey.
Yeah, I think, I'm so glad, again, you pointed that out. Like you said, that it is a journey, it is not an end destination, and that we constantly have people around us to help us, such as physicians like you at Baptist Health. So thank you for that. Dr. Friedman, could you talk a little bit about AFib, or abnormal heart rhythm atrial fibrillation? I was reading up on this, and I saw that almost 3 million Americans actually have this. Is that right? Did I read that number right? And that many people don't know they have this?
Correct. So it is the most common irregular heart rhythm out there. Now the rhythm itself, the older we get, the more medical conditions we get, or the world that I deal with athletes, the more miles we've accumulated as endurance athletes, does put us at risk for having atrial fibrillation or this irregular heart rhythm. For the majority of people, you're right, they're not going to know that they have it. But unfortunately, one of the things that comes along with atrial fibrillation is the risk of strokes. Little blood clots can form inside of the heart. They can break off and go to the brain or other parts of the body and really cause terrible effects. So atrial fibrillation is absolutely something that is in our population. It's all around the world, and we're only seeing more of it as we go. And certainly here at Baptist, in our own group, in the cardiology group, we have electrophysiologists who are coming up with all the latest and greatest techniques to deal with it, to ablate it, to get rid of it. In fact, I just spoke with somebody just before coming in here about atrial fibrillation and the great success she's had since her ablation. So we're only going to see more of atrial fibrillation, both with athletes and non-athletes alike, as we continue.
I'm so happy to hear that success story too that you just shared. That I think sometimes we're even afraid to hear the diagnosis because we don't know what that means, and so it's important for people to know too that there is a healthy lifestyle, and we're here to help you get that, or get whatever, help you manage whatever diagnosis you have. Dr. Friedman, we have a couple really great questions coming in, so I just wanted to ask you this first one, which says, this person says that they're hearing a lot of cardiac arrest lately. Is it related to COVID possibly? I think that's, whenever we hear about medical things, I think the first thing we think of, is it related to COVID? Could you talk about that?
Yeah, it's a little bit of a heavy topic. The out-of-hospital cardiac arrest rates have gone up significantly throughout the world as a result of COVID. Now, whether or not those are people who are dying at home with COVID and didn't come to the hospital or didn't make it in time, or they were afraid to seek care and didn't come to the hospital in time from other conditions, be it heart attacks or strokes, I think the jury is still out on that. But yes, absolutely. Unfortunately, people are dying outside of the hospital much more frequently than they were prior to all of this. And it only bears to your point earlier of, the hospitals are safe. Our offices are safe. If there's a concern, please do not delay the care. Please don't seek out because you're afraid of COVID. We are taking steps day in and day out to keep these places safe. We know exactly what we're dealing with when it comes to COVID in the hospital, and everybody's being kept very safe outside of the hospital as well. So don't delay the care. Don't be a part of that statistic of people suffering really terrible consequences at home.
Yeah, I think prevention is the best medicine we have. I'm sure you would probably agree to that. As we go through some of this, I think it's some of us may tend to kind of ignore some of these symptoms, maybe because we've had them for so long and we've just gotten used to them, or like you said, we're a little hesitant to go in to see someone because what about the possibility of exposure? And going into the hospitals myself and the doctor's offices, because I have to go to the doctor just like everyone else. I've been able to see the protocols and the procedures that our system is taking to make sure that everybody stays safe. So please, like Dr. Friedman said, don't delay. Dr. Friedman, another really good question here. They're asking, is the keto, a little bit of a shift here for us, but is the keto diet safe for a person with slightly high cholesterol? And I know that, the keto diet's really popular. So could you speak a little bit about that?
Yeah, I think diet is one of probably the hardest medicines that we prescribe in our world. So I think of diet, exercise as sort of being medicines. keto is certainly one that's out there. You hear of intermittent fasting, you hear of low carbohydrate diets. It's not a one size fits all approach. I do think it involves having a one-on-one discussion, looking at exactly what those numbers are, and then looking at also the health conditions that an individual has, and tailoring a diet that can help that person to achieve their health in the best way possible. So it's sort of a hard question to answer on a general front, but certainly individualized approaches work. And there are variations within keto also. So I think it's definitely something worthwhile talking to your physician about or a nutritionist and taking it from there. But yes, there are lots of different diets out there that can help somebody to achieve their health.
The personalization that you talk about, Dr. Friedman, as a therapist, I talk about that a lot too. One size does not fit all. And then when you take into consideration, like you said, whether someone's an athlete or someone's maybe not as active as an athlete, but still pretty active, somebody's age, their health history. I mean, I could go on and on as to the many reasons why, we talk about this personalization and having this conversation. I know a lot of times it is much easier to just go online and kind of Google and look around to see what most people say, but that's where this, we're such unique individuals. And even as you spoke about, you work with athletes that have AFib, but they're athletes and they're successful athletes, right? So please don't let any of these ideas of what my health should be or what I can do lock us in. That's where speaking to professionals like Dr. Friedman comes in. Talking about wellness, our health, different ways, diets to take care of ourselves. I've seen the explosion of these health devices, right? Whether it's smart watches that have expanded to GPS, measuring your heart rate. I think it measures your sleep depending on what kind you have. I guess, Dr. Friedman, does that really help? Because I know some of the devices will say that they can monitor your heart rate and tell you if something abnormal is happening. I guess what do you think about those devices, and how much information should we grab from them?
So it's a great question. This is undoubtedly the future. So we are headed in this direction where you're going to be able to wear a watch or some type of device, perhaps it's a ring or a necklace that can monitor lots of different variables for you. There was a study about a year, maybe 2 years ago at this point, that looked at a wearable device and was able to detect atrial fibrillation, as we spoke about before. So this will be the future. The question you have to ask yourself, though, when you're purchasing one of these, and a lot of them are not small purchases, they cost a lot of money, is what exactly are you trying to achieve and monitor when you buy one. So perhaps involving your healthcare practitioner, your physician in that discussion, perhaps your coach, depending on if you're a high-level athlete or not, can help you to sort of pick the right device. Where we are at right now in October of 2020, I think we still can't think of all of them as medical devices just yet. So if your watch alerts you, if your device alerts you that you could be having an arrhythmia, an irregular heart rhythm per se, I think it's really important to then go get follow-up testing, not to panic, not to think that anything terrible is going to happen, but to take your time, read through it, take that information to your physician, your practitioner, and then have that discussion about what it was, what happened, how were you feeling, and then figure out if further testing is needed. From a performance standpoint, if you're trying to improve your fitness or your athletic performance, they can be helpful, but again, a lot of the data out there's a lot of noise, and a lot of them haven't been validated just yet. So again, knowing why you're purchasing it and what you're purchasing it for can then sort of inform how you take it with you next to treat whatever it is you're looking for.
And what I'm hearing you say, Dr. Friedman, too, is that it's another tool that gives us information, but we still have to take those action steps afterwards to do something with that information, right? It's not the end-all, be-all of our healthcare per se.
1,000,000%. It's a clue that can then lead us towards a certain path. Again, if you're looking at it just from a fitness standpoint, well, maybe it will help you sort of improve your step count, improve your VO2 max, etc. But if you're using it for medical purposes, yes, it's really important then to take that information and use it for follow-up. And we in our clinic, we're looking at people's phones and watches and their data all of the time, which then helps us to inform the next decision. So yes, they definitely should be followed up upon, and a discussion should be had about those variables that are of concern.
Yeah, just lots of information. I think that sometimes what happens to us, right? We have information from our smart devices, from our smartphones, from our email, from the news, and it soon becomes overloading. So just take all of that. Even, you can start to write some of these things down. I write down the questions I have for my doctor when I go into the office, because sometimes I get there, I feel like, I feel better because I'm like, okay, I'm with the expert who can tell me what's going on with me, and then I forget all the questions that I had for you. So even something as simple as writing this stuff down, like you said, giving the information to your physician so they can take a look at it, can really help us.
And you're right. What you're saying too is when somebody goes to see their physician or whomever it may be, they only retain 20% of that information with them after the appointment is over. So again, have somebody on the phone with you when you're in that appointment. Perhaps you have a friend there with you if that's capable. My mom, when she goes to physician appointments now, will have me on the phone with her, and we listen in and we're able to retain that information more. So you're right. Lots of inputs into the system now. It's really important to hammer home what the take-home messages are and what was important, so that can then inform the next steps.
Dr. Friedman, that's something you and I have in common. I've spoken to my mother and I said, from this point forward, I'm going into every physician appointment with you, regardless of the fact that we live across the country. Just call. And, I find that most physicians are very welcoming with that. But, I think it's the effort that we're looking at and the fact that people really care about their health. So I do the same thing.
Great. And it doesn't just have to be with our mothers. It can be with our spouses, our siblings, etc. I mean, it doesn't matter how old you are. This is high level information that's difficult to take it all in, and it can be overwhelming at times. So it doesn't matter how old you are. It's always good to have support.
It's a very, very good point, Dr. Friedman, having that support, because there's just so much information that we're taking in. So thank you for that. As we're coming closer towards the end here, Dr. Friedman, we've talked about stress. Could you take us into a little bit of a deeper dive about stress? What happens? We get these flood of hormones, adrenaline, cortisol. What does that all mean for our heart health when that happens?
Yeah, so there's two types of stress hormones that exist in our body. One is like, we often liken it to living in a jungle. So the cortisol hormone is sort of like living in a jungle all the time, surrounded by lions and tigers and bears, and how that may just increase your baseline stress level. And then you have sort of surges in stress level, which tend to be these things called norepinephrine and epinephrine when you see the lion or you see the bear, and it makes you startle or get frightened. But prolonged exposure to all of those hormones is not good for cardiovascular health. I think we touched on it a little bit earlier, but they can increase our central adiposity, where we retain weight and how we metabolize fat. They increase our blood sugars, they increase our blood pressures, our cholesterol goes up, we don't sleep as well. All of these things, all of these variables that we know that can then impact the longitudinal cardiovascular health, how we live from a heart perspective, blood and our vascular perspective, strokes, etc., moving forward. So we want to try to deal with stress as best as possible. The best stress dealing with mechanisms that I have are number one, family and support systems are huge. I would be remiss if I don't mention exercise, because I think exercise is the best stress reliever that we have. To get outside, just move our bodies, even if it's just walking for 5 or 10 minutes, trying to eat a healthy, well-balanced diet. You'll see a lot with diet and antioxidants and anti-inflammatories. That's all well and good, but just eating a healthy, well-balanced diet can impact our body's ability to deal with stress. And our immune system goes down too. And again, as we kicked off with, we were talking about COVID. Stress decreases our body's ability to fight off infection. So we really want to try to minimize stress as much as possible. Again, knowing there's peaks and valleys. The stress will be high, it will be low, but how we sort of deal with all of that to level off as much as possible, I think, is really important.
Thanks, Dr. Friedman. Yeah, with stress, it's not something we can technically see. You can't put your hands on it, and so sometimes I feel like it's something we negotiate with a little bit, right? Like, it's not too big of a deal if I experience high levels of stress, it'll be fine. I think, again, for the past several months, we as a society have really been dealing with this. So I think, taking the tips that you've shared of paying attention to simple things like diet, exercise. I know it sounds so simple, but they really are the things that keep us healthy and keep those stress levels down. So important, not just, with your heart health, but if you think about it, our heart is one of the most important organs that we have. And I can tell you that it's not something that I typically think about. My heart beats without me having to do anything. So I'm not really paying attention to it. I'm just kind of going along my everyday life. Again, if anyone has any questions for Dr. Friedman, feel free to type those in so we can get them answered for you. Dr. Friedman, again, as we wrap up here, of course, taking the medications is important. You mentioned some other things. Is there any one, if someone could do just one thing today, what would you recommend that person does to take care of their heart health?
Without a doubt, is starting to exercise. So to me, exercise is sort of the cornerstone, which sets everything up from there. So if you begin to exercise, you will eat better. You will certainly sleep better. You'll be more in tune with your health and your body. I always liken exercise to a stress test every single day. So if you go out and you exercise and you feel good, well, that's great. Keep it up. But your body may tell you something, and it's not only true from a cardiac perspective. If you start getting chest pain or shortness of breath, or you feel abnormally fatigued, that's a warning sign. But with our sports medicine colleagues, if your knee begins to hurt you, if your back starts hurting you, perhaps something is wrong, and we shouldn't be pushing through that all of the time, and we should be aware of those things. And just to a point you made earlier as well, stress is really important, and dealing with stress starting with exercise from my standpoint is very important. All too often, though, people will tell us, oh, this is just stress, it's going to pass. It's, as you said, we can't quantify stress. So if I put a big ball of stress in the room, how two people will experience it will be completely different. And we can't blame everything on stress. Stress should actually be the last thing we blame something on after we've ruled out a lot of other medical issues. So yes, stress is important. Yes, it has very bad health effects, but we better make sure it's not something else before we start saying this is all stress.
That's a really good point, Dr. Friedman. That's the first time I've heard that. That should be the last thing we're looking at, right? Because as professionals, we're looking at everything else. We have to rule out to make sure that the rest of your medical health is okay. And one last question, and then we'll end, because I see someone typed in here. They just asked, Dr. Friedman, how long should they exercise for each day?
So the important thing is, especially if you're new to exercise, is just move for 5 minutes. Go for a 5-minute walk every day. With research, that's been proven to have health benefits. As you increase from there, what we want to try to hit are the guidelines for exercise, which are 150 minutes of moderate intensity exercise per week, or 75 minutes of high intensity. Now, the best way to define moderate intensity exercise is where you're moving, you're going for a walk, you're riding your bike, but you're still conversational. If we ask you how your day is, you can still answer that in full sentences. Versus high intensity is, if I ask you how your day is, you're going to be upset because...
And the State Department of Health reports more than 3,300 more cases of COVID-19 across Florida.
There are targets. You'll be on your way to healthy living for sure.
Great. Thank you so much, Dr. Friedman. And by the way, for any of you who are looking for exercise, we at Baptist Health have free virtual community health classes. You can check out the events.baptisthealth.net.